manager of physician engagement program. So like there is employee engagement where I'm taking care of physician engagement program here. So my job here is to make sure that physicians have a healthy life here, or healthy, they do something meaningful, they feel that they are part of this organization. That's how through some ways we have to make them feel that they are engaged in this organization. They feel they have the feeling of ownership. So
I'm a genetist here, so I'm working in a project called retinoblastoma, and this is an intraocular tumor which happens to occur in most children, and I think 1% of cancer around the world is because of retinoblastoma, and I'm currently doing the mutational screening of retinoblastoma. So patients who are affected with the retinoblastoma, they've been asked to come here, and we get the patient sample, be it blood sample or tumor sample, and we look for mutations in the retinoblastoma gene.
Because nowadays what has happened is there are very few people who are trained in ROP screening and ROP treatment, and a lot of pediatricians, a lot of neonatologists, most of them they're not aware, and so we are trying to create the awareness among the neonatologists and pediatricians, because their main aim is to first to save the child, and most of them they forget about the eye screening part.
I think in my work environment, interacting with my patient is beautiful. Being able to operate on my patients and give them sight is beautiful. And just talking to my patients is beautiful. Interacting with my colleagues is beautiful. And yes, I have been groomed in Aravind, when I was much younger, and this is the basis of the essence of life. He's so right about it.
Beautiful means doing the things also beautiful. If it is a simple things, escorting also beautiful.
Whichever is going to benefit the poor, be it research or any other aspect.
To learn many things.
Not a necessity of somebody should ask me to do something. So if I understand the values and culture and the vision of the organization, I don't require anybody to monitor me or supervise me. I myself, without any supervision, will do that. Okay? So that's the joy of doing something beautiful. Okay, so there is no direction, there is no supervision. But then to me, I know patients are the first, patients are at the center, and I will do something for patients. So that is beautiful.
The vision here is to give infinite vision to a patient, right? So, and I used to think when I was doing post-graduation, so whatever I'm going to work, I'm going to work such that it helps people live with dignity. So when these doctors treat this patient and this patient gets eyesight, that patient is able to work. He can earn his own wages, and he can live on his own. So they are helping that patient live with dignity. So it's my responsibility to help these doctors. So in a way, I'm helping, indirectly I'm helping somebody to live their life with dignity.
Currently, I realize that I have so much to work. And after seeing this, so many patients coming here, like, we get involved in that, and automatically that interest comes to you.
That's a good question, and once I see any patient and I think that they may require, like if I operate a child patient or operate a child, and I think they may require a regular follow, and they will not be able to come. So I ask them to be in WhatsApp. There's a lot of Facebook, WhatsApp. So I use that email address, and I ask them to send their child's eye photographs, so they can review them. And if there is any abnormality or any other change which I'm seeing on the photograph, I'd ask them to come here, or they can call me, email me anytime.
Exciting.
Excellent.
What do you call it when you, enlightened?
I'm very happy working in pediatric department.
I'm going to say awesome or fantastic.
One word means I am working. It's Aravind is proud in my life.
Idli.
Any seat.
அதான் நான் சொல்றேன்.
Puri.
Biryani.
I like idli.
They don't know. Food means we have chapati and puri and
Dosa. My colleagues is beautiful.